is we're going to talk about resistance training. So everybody get ready to go get swole. We're just going to do squats today and just call it a day in the interest of active engagement and active learning, right? Like no more lecturing, just going to lift and see kind of what all happens today. So I'm going to break this down in a couple of ways, okay? First, we're going to talk in some kind of general specifics, which I know is an oxymoron, about a little bit about what should you do. If you want to resistance train, what should we do? Then we're going to get into a lot of the actual adaptations that are going to take place. Like it's not enough to just simply say, great, you're going to lift, you're going to get bigger muscles to some extent, you're going to get stronger to a much larger extent. Yay, we're done. Okay. Although that is in fact what happens. We're going to dive into on both the neural and on the kind of muscle side of things. What is it that's changing? Okay. And I'm going to try to show a lot of data, some very classical data on here was the first time we realized that when you train, you get less co-activation of an antagonist muscle. Or when you train, you get greater synchronization of motor unit firing. Or when you train, it activates this particular signaling pathway in the muscle, and that leads to an increase in protein synthesis. Okay, so we'll try to walk our way through some of that. To be 100% honest, we could spend the entire duration of the course just talking about all of these kinds of things. Okay, so we're going to hit a lot of the high points. I hope if you want to know more about this, I'd be more than happy to give you some additional things to read. Okay. Okay. So big picture stuff. Why do we train? Ethan, you strike me as someone that's maybe lifted weights at some point in your life. Why'd you train? Sports, okay? Increased performance or physical function in those ways, okay? Good. Why might somebody else train? Brady, have you ever done resistance training? Why did you train? To get bigger, right? I want to be swole, okay? Muscle size, hypertrophy, okay? Most people don't always talk about, I just want to be stronger. They really talk about it from, I want bigger muscles. There's a lot of vanity we have to deal with in our lives in those ways, but these are the general kind of reasons why people do all of this, okay? I'm not saying one is better or worse than the other, but this is what you guys are going to encounter in the world. So we're going to talk about, to some extent, what's the stimulus, okay? If I want these things to happen, I'll let the secret out. They happen. You get bigger, you get stronger. Those things can, in some instances, lead to better physical performance or function from a sports standpoint, although the transfer of all of that is still somewhat debatable. But what's the stimulus, okay? So what do you got to do? We're going to send Gabe off to go do squats today. How much weight does he need to lift? How many reps? How many sets? Like, what's the point? What are we trying to get at to drive these changes? How often do you have to train? Okay. We'll talk about the stimulus. We'll talk about what it is that actually changes nervous system and muscle side, and then kind of what are the mechanisms that are at play in this and all of that. Okay. So I think we talked about this with endurance training. If we didn't, we should have, and that's on me. But a couple of concepts, okay? A couple of concepts. So how and why does training of any kind work, specifically resistance training? So the adaptations are going to be directly linked to the increased demands placed on the neuromuscular system. This is broadly referred to as training specificity. Okay, training specificity. Which is why the way that most people train, if we walk across now, it's 3 o'clock, right? It's Monday. What are the bros doing today? Chest. Okay. Sarah, you've been a college athlete. Do a lot of things where you push people away from you like this? No. Okay. Can you think of a sport where this is a primary influence on what it is that you do? Maybe if you're an offensive lineman in football, maybe. Although these days, if you're a wide receiver, you just shove people away, catch the ball, they don't call interference, okay? You play soccer, do you do a lot of this? Probably not. Not too much. Play basketball? I mean, you shove people that much, probably a foul, okay? I'm just saying, okay? I'm just saying. Most of our bros over next door, why are they doing it? Physique? I don't know. You all tell me, do you find well-defined pectoral muscles or large pectoral muscles to be in some way useful or attractive in another person? I don't know. Okay. But the idea of training specificity, we've got to keep this in mind. Okay. This is really important when we look at nervous system change. What's happening in your nervous system? Okay. If you do squats, guess what you get better at? Squats. Guess what you specifically get better at? Doing squats, the number of reps with the amount of weight that you were doing. Okay, that's a thing we've got to be really careful about. And so, much like with aerobic training, a lot of the things are going to occur to limit the disruption of metabolic homeostasis. Similar-ish kinds of things are going to happen. We're going to limit the stress placed upon the overall neuromuscular system. Sometimes from a metabolic standpoint, but also from a kind of how we're distributing the load and those kinds of things. Okay. I feel like I've shown this before to you guys. You exercise, we evoke some sort of acute change, right? So Gabe goes over, he does some bench press, he loads those particular muscles, that places stress on there. There may be some hormone release, which should be released, I suppose. There's maybe some metabolic stress, there's some stuff that happens, right? That's the kind of acute change that disrupts homeostasis. That disruption, these things that disrupt kind of the normal, regular resting routine, provide the stimulus. We get the stimulus often enough, we get an adaptation, and that adaptation then limits these things like increases the strength and hypertrophy, limit the mechanical load, the metabolic stress, and this kind of thing, limit these acute changes, okay? If you do the same kind of exercise again, it limits the amount of acute change we get, and that will hopefully let us reach our training goal. Okay? So if you look at things kind of as we go along here, depending upon what our goal is, we need certain adaptations. Therefore, we need to train in a certain way to evoke the correct stimulus to drive that particular adaptation and not some other. Okay. Other things, this idea of progressive overload, which is really, really important. Okay. We see this a lot. I'm sorry, ladies, you all tend to be the ones that demonstrate this in my particular experience. Although guys do it too, I'm sure. Guys generally are like, I'm gonna lift a bunch, like whatever. They want to overload a lot. What tends to happen though is the idea of progressive overload is that training must take place at a higher intensity than what you're accustomed to. Okay, and what you're accustomed to. So if Skillet's used to doing, I don't know, we'll say she's a power lifter. She's used to doing power cleans with 150 pounds. Okay. Then at some point, if she continues to do power cleans with 150 pounds, she adapts, that becomes easier. It is no longer an overload stimulus. All right. It's not enough to disrupt homeostasis. Therefore, she must do more reps or more sets, or the easiest way is lift more weight. Okay, you must progress to continue to overload. Okay, and that's going to be the thing. So what tends to happen in a lot of instances is people will do something and they're like, this was kind of tough, and they just sort of keep doing the same thing over and over and over again, and they never make it more difficult. A lot of times this is done because people are under the mischaracterization that I don't want to get my muscles to be too big, right? As we've already talked about, ladies, your muscles aren't getting that big. Guys, your muscles aren't getting that big either, okay? Some of you, knowing how much you probably worked out, would you look like Mr. Olympia or something, right? You're not going to get that big. So this is a place where people don't maximize things very, very well, okay? So when we look at a training protocol, you can pick an exercise. We're going to talk about the intensity, and I'll show you guys which of these things kind of matter in the next few slides. So the weight that's going to be used, so what's the intensity, the number of sets, the number of reps, your rest period, the order of exercise. I'm going to be really honest. This is not my thing, okay? And when I say it's not my thing, I think we overcomplicate resistance training so much because people want to sell you something. They want to sell you their training program. They want to hire you as their collegiate strength and conditioning coach. It's not that hard, okay? Get a weight that's pretty difficult. Lift it 6 or 8 times for a couple of sets. You can't, once you lift it, you can't do anymore. Take a couple of days off, come back, do it again. It's not that hard, okay? When it gets easier, add some weight, add a set. That's it. You're better by doing that than 95% of all people that exercise. 95%, okay? There's nothing magic about doing 12 sets of 2, or we're gonna do bench press with fucking chains on there, or whatever else. It doesn't matter. It's such small marginal bullshit gains that maybe if you're an Olympian it matters, but for the vast majority of all people it doesn't matter. Okay, go in there, work hard, be consistent, and you're going to be better off than the vast majority. Most of you can't make your muscles that big. Most of you can get a lot stronger, but there are limits to that too, and that's it. And then go practice your sport. Right, go practice your sport. That's the other thing. Okay. Anybody golfer? Anybody play golf? No, I'm the only golfer right here. Okay. Well, that stands to reason. Right. Middle-aged, upper middle class white guys to golfer. Big shock there. As you look at all of those things. So just gonna say, I can lift or do whatever I want. It's not going to make me a lot better of a golfer in those ways. Playing golf, specificity of training, playing golf. If you do it right, it will hopefully make you a better golfer in those ways. Okay, so think about these kinds of things. All right, so let's get this out of the way. How much stronger can you get? Okay, an average person starting from a relatively untrained place can probably increase their maximal strength. So we're talking about 1 repetition maximum, the most weight you can lift to a full concentric eccentric range of motion, maybe 25 to 100%. Okay, if you're really untrained to start with, you may be able to increase it to 200%. But for most of you, if you can right now, today, because it's Monday, bench press 100 pounds, we could probably train most of you and get you to be able to lift close to maybe 200 pounds. That's not that unreasonable. Okay, but that's a big increase. Right? You're not probably going to double your VO2 max. Okay, you're not going to double your left ventricular volume and therefore double your stroke volume, but you can get a lot stronger. Okay, a lot stronger. We tend to see greater increases in dynamics of concentric eccentric strength compared to isometric. We'll talk about why that is in a few slides. Okay, we see similar gains between men, women, old people, and young people, as long as we normalize for where you are to begin with. Okay, it took, I kid you not, until the 90s for it to occur to people that maybe we should compare the strength changes in men and women relative to where they started. They're like, oh, the woman can lift 100 pounds, the guy can lift 200 pounds. The woman can now lift 200, the guy can now lift 400. Clearly, the guy has a greater ability to increase his strength. And you're like, no, nuts, that's not true. They both doubled their strength output. Okay? We've not treated you ladies very well from a physiological perspective over time. But we now know y'all are just as capable of getting stronger as men. Okay? You will see when we talk about size, you're just as capable of increasing your muscle size as the vast majority of men. Okay? It's all about being relative to where you start. Older people, up until you're in maybe your late 70s or your 80s, older individuals can increase strength, they can increase muscle size. Once you get to a certain kind of threshold age, as I said, about 80 or thereabout, we can't continue to increase muscle mass. We don't fully understand why. We'll talk about some speculation on that next week. Okay? But you can't continue to increase. But you can at least prevent some of the loss that comes for us with sarcopenia in age. Okay? Everybody has some genetic potential. I'll show you guys some data on all of that too. You all have some genetic potential. Some of you look at weights, get big, get strong. Others of you work out really hard, do everything perfect, perfect nutrition, and you're like, man, I'm not getting very much. Okay? It's just the way that it is. Thank or curse your parents. That's the way that it's going. When we look at strength gains, we tend to break them down into two buckets. Okay? Changes in the nervous system, and then changes to the actual contractile protein apparatus. This is neural adaptation. So this is recruitment. This is firing rate. This is synchronization. This is how you turn on the muscle that you have. And then the second part is just how much muscle do you have. Okay. And so what we'll figure out is that the time course and individual contribution of each of these components is going to vary among individuals. It's going to vary based upon your previous state of training. It's going to vary on a whole bunch of things. But generally, it is thought that both of these things are going to work together. Okay? They're both going to work together. Although there are some people that argue that an increase in muscle size plays no role in increasing your maximal strength, which I just can't wrap my brain around. It's dumb. Okay. All right. Have I shown you guys these data before? These are my favorite data. Okay. So here is a study that was published in the mid-2000s. Okay. Almost 600 participants. So it's this giant study. It was conducted at UMass, at Yale, and I believe at Boston University. And what they did was, this is, I want my thing not turn off. They did bicep curls, one arm bicep curls. For the first 4 weeks, they did 3 sets of 12 repetitions with a weight that they could only lift 12 times. Okay. So basically 3 sets of failure. Then they did 3 sets of 8, and they did 3 sets of 6. So this is not that much. They did this 3 times a week. Okay. What you can see here, these are called histograms. My folks in stats, y'all seen a histogram? Don't throw things at me, please. Okay. But this is increase in strength, 1 rep max gain, and then this is maximal voluntary contraction. So this is an isometric contraction. Okay. And then this is their dynamic 1 rep max. And what you will see is that this is each bar, the height of the bar represents the percentage of individuals that saw roughly that amount of a change in strength. And then the x-axis is the actual amount of strength gain. So what we see, if you look at the means, and we have men in the dark bars and women in the light bars, and I know it's kind of hard to see, but we had men increase their 1 rep max about 40%, women about 65%. We look at their MVC, so their isometric strength, men were about 16%, women were about 22%. Okay? And so much of this, though, is if you regress all of this out, the people that saw the biggest changes, they were generally the weakest ones to begin with, and the ones that saw the smallest amount of an increase were, in fact, the strongest to begin with. But if you look at, especially on the MVC, this is kind of a nice normal distribution that we're going to see. I don't really know what's going on out here. Well, we've got this big spike of ladies that are getting like 100% difference, but you will look, there's some outliers way out here, got a lot stronger. There's some people that showed basically no changes. Can you imagine doing all that shit for 12 weeks and you've got no stronger whatsoever? I'd be so mad. Like, what am I doing? So I have some data, these same data for increases in muscle size as well. They need MRI to measure muscle size. And so this is one of the largest studies of its kind that has ever been conducted. And so I think because it's so big and it has men and women, you can see this nice kind of normal distribution. Gives us some really good insight into what we might reasonably expect from some folks. Okay. Here's the percent change in cross-sectional area. All right. And so again, we have men in black and women in the white, but you will note here's the kind of nice normal distribution. Men increased their muscle, the cross-sectional area about 20%, women were about 18%. That was not statistically different. And so here we go. But you got some folks that were like 50% bigger, some folks that actually got smaller. Again, I would be so mad if I did all of this, my muscle actually got smaller.
How does that happen?
How does it happen?
Yeah.
I don't know. I mean, this is an MRI image of their bicep. This is as accurate as we can do all of this. I mean, somebody might have made a mistake. Maybe they somehow they lost weight during the whole thing. I don't know, because they should have, if they lost weight, like they should have thrown them out and things. But I'm just saying, sometimes you just stuff happens, man. Stuff happens. Right? So I mean, these are true in some ways non-responders, and there are some super responders. But again, look, men and women, they're about the same. This is young college age folks. This is about the same. Okay? So again, strength, women a little bit more than the men because they start off being a little bit weaker. I know we're all surprised. We went over, right, that you see the guys doing curls with the big weights, and ladies, I know none of y'all in the room, but sometimes a little lighter curl weight probably, right? That are going to be over there. I see people doing stuff. I don't understand it, but I see it. Okay. So there we have all of those things. Okay. So let's talk about neural adaptations. Let's talk about some of the things. And I'm going to give you guys an overview here. And then I'll come back and show data on which a lot of this is going to be based. Okay. So neural adaptations, or sort of better able to recruit your muscles to generate a given amount of force or to get more force out of the muscle that you have. They're sometimes called learning effects. This is the idea of I learned how to ride a bike. We were trying yesterday to get my daughter to ride her little glider bike. And we thought if we take her over and her little best friend that lives a couple of streets over is really good on her glider bike. She has an older sister that she needs to chase around on the bike. We know if Ella sees Emmy riding her glider bike, maybe she'll take off. No, she outsmarted all of us, and she just put the glider bike away and got her little scooter and just scooted around and chased after her on the scooter. And I was like, thwarted again. I don't know why I care that she rides the glider bike. I think it's just as soon as she rides the glider bike, and the sooner we can get her a regular bike, and then I don't have to put her behind me when we ride around a bunch. But that's this idea of a learning effect. Okay? You learn a particular neuromuscular pattern and skill to do things, and off we go. Okay, so what is it that adapts? We know a lot. We don't know everything, but there does seem to be some increased ability to recruit, especially type 2X motor units. Some ability to increase the synchronization of recruitment. We'll talk a little bit more about that later. You can turn off the Golgi tendons. You may be able to increase the firing rate. The real big one really is this first one. And this is the big primary driver in a lot of ways, is that you have X amount of muscle. You can't use all of it right now. If we train you, your brain will learn how to be better at using almost all of the muscle that you have. Okay? We can see neural adaptations within one bout. Okay, within one bout. My favorite undergraduate day in our class, which I've been deprived of, okay, for a while. Brady, when you had me, we do the strength lab. We actually get to lift today. You had me as an undergrad. We bench press. We do bench press 1 rep max. It's my favorite day. Okay, so we got a bunch of people in class that have never done a bench press in their life, and it's so much fun to watch them try to do a bench press. Okay, and we've never tested this, but you give people you've never done something. You do it once, you come back the next day, and you're already better at it, right? Because the reason that you're bad is you just never practice it. You have no clue how to have the correct firing frequency, how to recruit to certain muscles, and make everything go together. So we see things that you do stuff today, you come back tomorrow and you're better. Any of you that want to do research on measuring muscular strength, okay? Lots of evidence. Somebody comes in, and you want to know their maximal strength. They come in, you test them today, you better let them come in and practice a couple more times because they're going to get better at doing it. Okay? Generally in my lab, when we measure like quadricep maximal voluntary isometric strength or bicep maximal voluntary isometric strength, you get at least 2 days of familiarization and practice because, and then we're going to watch and you can see you get stronger and then eventually you'll figure out like, okay, it's kind of level off, all right, because of these things. So it happens fast, well before any increase in muscle size. This is also a problem for exercise adherence, okay? You take people who've never done resistance training before and they get a lot stronger really quickly. Like in the first month or 6 weeks, they get really strong really fast. Or, you know, I can lift 50 pounds, now I can lift 100. And then they get good at this, and then they got to wait for the muscle to increase in size to get any more increase in strength. And so then it sort of really kind of levels off over time. And they're like, what the hell, man? I was getting a lot stronger. Why can't I continue to go up, you know, like 20% every couple of weeks in strength? And you're like, dude, you kind of maxed out what you got. You got to get more muscle. So well before any increase in cross-sectional area. Okay. Generally, it takes about 8 weeks, maybe 6 if we've got some high-res imaging, if you've got CT or MRI. 6 to 8 weeks to see a measurable, noticeable increase in muscle size. Okay, which can also be a problem from an adherence standpoint. People are very visual, right? I want bigger muscles. I don't want to have to wait 2 months. I want to know that I'm making progress like tomorrow, or I'm going to stop coming in here and do things. So it takes a while. The neural adaptations that you get are very, 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 I cannot emphasize enough, very specific to the exercise type that you're doing. If you are training doing squats, you will get better at doing squats through the exact range of motion with the exact weight that you're using. Doing squats is not necessarily going to make you better at doing knee extension, even though it uses the same muscle groups. Okay. Doing bench press doesn't make you better at doing squats. Doing bicep curls doesn't make you better at doing calf raises. All right. So it's very specific to exercise type. Right. If you do concentric eccentric actions, you get better at concentric eccentric actions, not necessarily isometric. It's very, very specific. Okay. There's a really cool phenomenon called the crossover effect, where if we take Josiah and we have him train his left arm gets stronger, but also his right arm gets stronger, even though he hasn't touched a weight with the right arm. Okay? Called the crossover effect. So the nervous system adaptations, because of the way the brain anatomy is, the way the sort of motor neuron location is in the spinal cord, there seems to be some crossover in these neural pathways that we do not fully understand. But the nervous system is very plastic in that way. Connections can come and go. They're very, very sort of trainable. And so you get some crossover effect. We'll show some data on that a little bit later on. This is really cool if you're going to have to rehab an injury or you're rehabbing a stroke patient or somebody. They've got a good side, they got a bad side. Train the good side and the bad side gets better. Okay? Or you're about to have ACL surgery. Train the side that's not getting surgery, and you won't lose as much strength in the side that had the surgery because you've got to wait a while before you can do kind of heavier lifting. It's just really kind of interesting applications to all of that. Okay. Let me take you way back, okay? I'm going to ask this question and then I'm going to immediately regret it. How many of you were alive in 1989? Anybody? Jordan looks at me like you know.
I was born 10 years ago.
Okay. How many of you were alive in 1990? So, okay. So it's 1989. Dr. Black is 11 in 1999. Thank you all for making me feel very old. It's great. We had like sort of family pictures taken this weekend. And they said it's one of the preview things with my wife and I. And it's the first time I'm like, oh my God, I'm a middle-aged man in a picture. I know I've been that for quite some time, but I'm like, oh, the beard is looking kind of lush, very kind of gray. And I'm like, oh no, no. When did this happen? So we're just going to lean into it. So these are some data from a guy whose name is Marco Narici. These were some of the very first data ever published where we have MRI data on, this is in the thigh, so this is in the quadriceps, on the cross-sectional area, the change in muscle size, and we've got a trained leg and an untrained leg. And they did about 60 days of training, so 2 months, 8 weeks of training, followed then by about 40 days of detraining. But they have cross-sectional area, we have maximal strength, MVC here, and then what's called an integrated EMG. I know we've talked very briefly about EMG before, but what EMG is a measure of, you put electrodes on the surface of the muscle, and it measures the electrical signal in the peripheral axons and along the sarcolemma in those muscles. It's a terrible measure, except for no measure. It's really good at the muscle is on, okay? It's on. And maybe it's on a little bit versus it's on a lot more. Trying to do too much more with the EMG signal becomes very fraught with what we're trying to gather, because there's some weird things that happen when you fatigue a muscle and you do some things with the EMG. But muscle size, a very gross level estimate of how much nervous system can turn on that muscle, and then maximal strength. Okay. So here you have, and I drew in the red lines, kind of the way they made their charts here. They're looking at the percent increase. Instead of making it 0, they just made it 100. And so what you can see is 60 days of training, they got about a 10% increase in muscle size in the trained leg. Bam, no changes in the untrained leg. If we look at our kind of gross estimate of nervous system adaptation, the kind of integrated EMG goes up about 40% or so, okay, over that time, and you can see this kind of gradual increase. Look though, integrated EMG goes up in the untrained leg. Voila, crossover, all right? If you look at maximal voluntary strength, it's up about 20% here, and then it's also up about 10% in the untrained leg, okay? So some kind of interesting data, so you can see the change in muscle size is slower than this change in integrated EMG and this kind of change in force production that we're seeing. So, but note, the integrated EMG is not a great measure because it's up 40%, strength is only up 20%, plus there's like a 10% increase in size. And so this is affected by multiple things, not all of which lead directly to increases in strength. But these were some really wild data at the time. These are some of the first data that showed all of these things together and showed that there may be some neural adaptations that happen in the contralateral leg. Okay? And I apologize, I should have put on here what they were doing. It's just simple knee extension exercise. It's like 3 sets of 10 with 70% of maximal strength at 3 times a week. Okay? But some of the very, very original data to try to look at all of that. Okay. So here are some other ones, and I want to present you guys with a wide swath of things because I don't know what you guys may want to do in the future, and so we have to appreciate that sometimes weird things happen with training, and to try to then understand how we might interpret those data and why they may look weird but actually make sense. Okay, so these are some data from Lori Plautz. Her name is now Lori Plautz Snyder, but she collected these data when she worked with my PhD advisor when they were at NASA. And so NASA was very interested. One of the things that spaceflight does is your muscles shrink and your nervous system's ability to turn those muscles on goes way down. And so NASA knew as they were prepping for longer spaceflight and for the International Space Station, they knew we've got to figure out what do we need to do in a way to train to prevent these things. Lori's now at the University of Michigan, but she was like NASA's chief flight neuromuscular countermeasure person for like 20 years. So she was in Houston at Kennedy Space Center that's in Houston? Okay. Anyway, so she was there, but she's at the University of Michigan now. So these are 9 dudes. They train their left leg 2 times a week, 3 to 6 sets of 12 reps. They did 9 weeks of training. And what we found, and so these are data from something called T2 MRI. And so Drew and Jordan may know what T2 MRI is. You guys heard of that? You ever done T2 MRIs? T1 usually is a structural image. That's what most people get. If you've ever had, like they thought you've got inflammation or torn a muscle or a ligament or a tendon and you did a clinical MRI, you get what's called a T2 MRI, because in a T2, areas where there's extra water accumulation, it lights up brighter. And you can, what they did was, you do a bout of exercise, you lift, and then we throw your ass in the magnet right when you're done. And remember, when we lift, we drive fluid, contracting, we drive from hydrostatic and narcotic pressure, we drive fluid into the muscle. And the T2 image lights up. And so you can use that to see how much of the muscle is showing this increased T2 signal as an indicator of roughly how much of that muscle might have been engaged during exercise. Right? And so what they found was, here is the right leg or the untrained leg. Here's the left leg, which is the trained leg. And what I want you to look at is they had them lift the same absolute load. And then this is the percentage area of the muscle that showed this increase in T2 signal. And so after training, they were using less muscle to lift the same absolute load. And there was a larger sort of decline in muscle used in the trained leg, and a little bit kind of again a crossover effect that was being shown right there. Okay. And so what they basically saw, we look at pre-training, post-training, they got an increase in muscle size, they got an increase in strength and all these things. So we're using less muscle to lift the same absolute amount, which is kind of cool, right? And so one of the other things that not only can you actually turn on more muscle, more of the muscle you have, but another consequence is when you do submaximal things, you don't have to use as much muscle. You don't tax as much muscle, which may be a potentially useful thing. Okay, so here now we're going to move to, and these are not the first data that showed all of this. I just like the way the graph was pretty straightforward that was set up. So this is something called voluntary activation. This is measured through a technique called twitch interpolation, which I know we had talked about before, but I'll go back over it again. Okay, so what you see here is you can do this in any muscle that you want. Okay, but these are from the quadriceps. So you have a person, they're sitting on a dynamometer, and you tell them to kick with their right leg as hard as they can kick. Okay, it's isometric, nothing's going to happen, they're not going to move. This only works during isometric contractions. Kick as hard as you can, and then while you're kicking, in this particular study, they stimulate the femoral nerve with a large amount of electricity. Okay, and so they zap you with extra action potentials, and you're kicking, and they look to see when we zap your nerve and we give you extra neural input, do we get additional force production? Okay, and so we then figure out if you get an increase in force, that means there is some muscle that you are not able to recruit. And what they found was, this is before and after, I think it's 12 weeks of training, that people in their quads went from being able to turn on maybe about 82 to 85% of their muscle to turning on about 90% of their muscle in their quads. And they had a control group. Nothing happened. There were no differences in their control group in that way. And so this is some data which have been repeated on multiple occasions, that what this tells us is, as we train, part of what this integrative EMG is showing is actually a bigger neural stimulus that is leading to greater motor unit recruitment. If you have more motor unit recruitment, There will be more peripheral axons that will depolarize. There'll be more sublimma that will depolarize, which is what's actually driving that increase in the surface. Okay. So we know with training, you can turn on more motor units. Most of you, okay, if you're not very well trained, or if you don't lift weights with your legs, let's just say, most of you are probably going to be somewhere in the high 70s to the mid 80s in your ability to turn on the big kind of quads, glutes down here. In your arm muscles, we're all pretty good at turning on our arm muscles because our arms are smaller. Everyday activities require closer to the maximal strength, like carry groceries and do things, and so you tend to be better. Arm muscles and untrained people, probably around 90% of the motor units are going to be turned on, so there's less of an ability to increase it there. Okay. So if we are getting more motor units turned on, how does that happen? Si, do you remember how we turn on a motor unit? Where does the stimulus come from? Sorry? No. So like if I want a depolarization to occur in the spinal cord, in the motor neuron, right? And it's going to be during a voluntary, like I'm going to jump or something. Where does the signal come from that tells the motor neuron to depolarize? Yes, from the brain. Very good. Okay, from the brain. So, do you think if I told you to try to jump as high as you can, that you can do something now to let you practice jumping, okay? Do you think you're going to get a bigger output from the motor cortex after training than you did beforehand? If the assumption is you can turn on more motor units, and you need a signal from the brain to turn them on, you think that signal might go up? It might. Okay. There's not a lot of, it's hard for us to test that. There may be a little bit of evidence that it goes up some. But one of the things that we know happens is we see a change after training in something called spinal excitability. All of the motor neurons in your spinal cord have a resting membrane potential. That resting membrane potential is determined by what the cell naturally has. We could do a class on motor control. It's also determined by the net signals from inhibitory and excitatory interneurons, and a whole bunch of other things. Okay. What we know after training is that we seem to lower the inhibitory signals or increase the kind of excitatory signals from those interneurons. The net outcome is it takes a smaller input from the brain to tell or get that motor neuron to turn on and polarize. Right? So we call that spinal excitability. We've moved these motor neurons closer to their threshold potential. And so here are some data from a very, very famous Scandinavian neuromuscular physiologist. His name is Per Agard. I'd like to have 4 A's in mine with 2. He's a really cool dude. If you guys ever get a chance to see him speak at a conference, that they do some really crazy stuff. It's really, really well done. But they have measured something called the H reflex. Okay? The H reflex is a way to assess spinal excitability. So you guys know about reflexes? You guys know about like spinal reflexes or anything like that? I'm going to show you guys a reflex. Let's see if I can do this. So last night, my daughter was telling me she has this little document stuffings that Larson's gave her, like little medical kit thing. And it has a knee hammer in it. And she's whacking my knee rather hard in some ways. But so I'm going to try to sit here and see if I can do this. Relax. So if you hit the tendon, your knee extends, right? That's a reflex. So I stretch, right? You hit the tendon, it stretches the muscle, it stretches the muscle spindles. The muscle spindles signal, right, via the 1A afferent nerve back to the spinal cord, and they tell the alpha motor neurons that go to that muscle to turn on. So one of the ways that we can assess the H reflex is if we zap to this afferent neuron, the afferent nerve, and the efferent motor nerve, the axons are all contained in the same nerve bundle. And so if we stimulate them, so this is generally done, you can do it with the femoral nerve, it's often done with the tibial nerve, but you stimulate them, okay? And what you figure out is if I change sort of the excitability in the spinal cord, I get a depolarization from the reflex at a lower actual electrical stimulus. And this is some things, if you guys want to know more about this, we've done a couple of studies with this in the lab. Dr. Pereira has done a couple of these things as well. It's a pretty kind of crazy thing. You can do all sorts of fun stuff, like you can measure the reflex and you can have people do math problems in their head, and you can alter spinal excitability like that by doing math problems. And it's pretty wild. But training basically means that you're getting a bigger H reflex at a given point. So spinal excitability changes. Don't worry about this thing called the V wave. The V wave is really kind of done simultaneously with the H reflex. The V wave is an H reflex during a voluntary contraction. And what you get is, for the most part, how much of the signal from the brain is actually getting through the motor neuron and making it out into the periphery. So these are both things, if anybody cares about, that my lab can measure, that Guerrero's lab can measure. They're kind of some fun ways to try to look at it, tease out where changes maybe happen. But what you see is more of this is getting through changes in excitability, so we know there's some things that are happening in the spinal cord in response to training. Okay. That's probably more explanation than the rest. Here are some data from 1981 from Vic Piazzo, and this is going to show some things about changes in recruitment. So these neural adaptations are very, very specific to the task that you're performing. Okay. And I think these things especially are going to have a lot of applicability to sport-specific training. And so what you see here is the x-axis is velocity. So they had people train, this is at low velocity, 0 radians per second, all the way out to 5 radians per second. We could figure out what this is. This is they're training at about 240 degrees per second versus about 90 degrees per second. This is pretty slow. 90 degrees per second is pretty slow in contraction. So it's not super fast. And so when people trained at a slow velocity, their increase in strength was greatest here at these slow velocities. They got a little bit better at fast, they get a lot better at slow. When they trained really fast, they didn't get very much better at slow, but they did get better at fast velocities. Okay? And so you look at all of this, and again, this tells us that whatever it is that you want your outcome to be, you need to train in a manner that mimics some of that. Although I look at all of this and think it looks like the slow velocity got me both better at slow and at fast, and the fast didn't get me squat here and got me about the same out there. But we've got some more data on all this. These were just some of the first. Okay. This is showing the percent increase if you look at isometric strength. So this is knee extension isometric strength. Goes up about 20% or so, whereas the amount of weight the person was doing when they're doing their knee extension exercise went up almost 200%. Okay. And so again, they're getting a lot better at doing the dynamic contraction that is just like whatever it was they were training with, a little less so doing a different kind of contraction. Okay. We think that isometric contractions are mostly a measure of muscle size and changes in muscle size. Whereas the dynamic ones is going to really be very specific to kind of being better at doing whatever amount of weight you're lifting dynamic. Okay, let's talk about firing rates. We talked about our ability to turn on and recruit the muscle. Now let's talk about firing rates a little bit. Measuring firing rate is incredibly difficult. I want to start off by saying that it's incredibly difficult. We've got older folks and younger folks in the midst of this. So these are things that are measured over the course of about 6 weeks or so, right? Yeah, so about 42 days. And so we've got older people that are training, older people that are untrained. We've got younger people that are training, young untrained people that are doing this here. This is their force production, okay? You can see how much stronger they will be. So you will note, if we look at our sort of young folks that we're training, they're off about here, they're getting about, right, their force is going up about 20 or 25%. Okay, here's the motor unit discharge rate. And what I want you guys to note is that, see, it goes up, then it comes back down a little bit, and then it goes back up a little bit. But especially in the young people, this is basically maximal firing rates, somewhere in kind of the mid to high 30s, goes up into the low 40s, and then comes back down a little bit. I don't really understand what's going on here, but then it's going to go up, maybe 5 or 6 sort of hertz over the course of time. Okay, so there is some evidence that you can increase maximal firing rates. This is needle EMG. These are small muscles. We've jabbed a bunch of needles in. We're hoping across multiple testing sessions that we're getting the same motor neurons and things. It is very, very, very difficult to measure these kinds of things. Okay? So the fact that we have any data that is kind of nodding in that direction, that there may be some small, subtle changes and increases, I think it's really important. Okay? So we've seen evidence that motor unit recruitment goes up, probably because spinal excitability goes up. Firing rates may go up a little bit. This may also be due to the increase in spinal excitability. And there may be a little bit of supraspinal stuff that's going on. Okay? So another thing that we found, these are some really well-known data from Caroline and Enzo Caffaro. Enzo is no longer with us. Enzo was a noted curmudgeon. He would come by some of my students' posters at conferences and fuss at us about dumb things, but a really kind of good fella and a really brilliant scientist. So these were taken from when Enzo was at UT Austin, which we will forgive him for. But they did knee extension exercise, and so you can see this increase in knee extension force over time. This is isometric force of the knee extensors in response to 8 weeks of training. Here I want you to look at the change in the surface EMG signal of the biceps femoris. Now, I never had anatomy, but Elise, I know that you have. What's the biceps femoris? Yes, it's a hamstring muscle. So this is an antagonist to the knee extension. And what we find is, and you guys may not know this, but when you contract the muscle, the antagonist muscles usually will fire at the same time in an effort to stabilize the joint. Okay. So if you've got a situation where I get this much force out of my agonist, okay, and then we're also getting a co-contraction of the antagonist that is about this much, so we're going to call this co-activation. So I'm getting this much. The amount of force that my agonist is actually producing is this plus whatever this is on top of it, because this is counteracting this, so I get this net force here. So when I turn down the amount the antagonist is firing, more of the actual muscular force from the agonist is going to go not to overcoming co-activation, but can go to the actual movement that we're getting. Okay? And so this may seem really obvious, but until again the early 90s, nobody had ever measured all of this. So one of the things that happens as you get better at doing things is you turn off antagonist co-activation. So when you do quad exercise, you shut off your hamstrings. And when you do hamstring exercise, you shut off your quads. When you do bicep exercise, you shut off the tricep. And this is really, really important. So what it allows is more of the force from the agonist muscle to go towards the actual movement that you're doing. Okay? So there's a lot of other interesting things that go into all of this. We don't fully understand why. Some of it we think is Golgi tendon related, or maybe a lot of it is Golgi tendon related. You sort of train yourself in this way, you begin to shut off some of the Golgi tendon. And the Golgi tendon is what activates the joint, activates the antagonist. Okay. What about unilateral training and bilateral training? Maybe okay? Just a wild sort of look in my eyes there. So what about this? Okay. And again, things that people probably care a lot about that I think are pretty dumb. Should I do curls where I sit in the, you guys know what a preacher curl bench is? Anybody seen a preacher curl bench? But you sit down and it's like this angled thing in front of you and it's a pad, okay? Should I get a barbell, okay, and train curls with 2 arms, or should I get a dumbbell and train with just 1 arm all by itself? Which one's going to get me the strongest? Well, people have tried to test all of this. So these are some data from the mid-90s, and I forget which Hakkinen, there's a couple of them. I think this is from Nico, but I'm not 100% sure. So they had a group of people, okay? So here we had these before. They had a group that trained bilaterally and a group that trained unilaterally. What you see here, this is their bilateral 1 rep max. And so you can see the group that trained using both arms got stronger doing both arms than the group that trained with only 1 arm, although both got better than where they were before. Here's the group that trained the unilateral 1 rep max. So if you test me, the group that trained with both arms, okay, got better than they were before when we test them using only 1. But the group that trained with 1 arm got even better at that. So here we've got some level of training specificity. And if we look at the EMG from some of these things, what you generally see is, especially with the bilateral, is it seems to be better. Okay, so there is some transfer of these things, but what you should take away from all of this, and some people I think have interpreted this one way, others in another way, is whatever you're going to do in your sport, you don't do a lot of things where you're using both arms simultaneously, like in the same kind of way, unless maybe you're a rower or something, okay? Then you should probably train each limb independent of the other one because it gives you a greater increase in force in that limb for that range of motion. Okay? But doing 2 arms is going to be that. So this is my stick for 1-legged squats, okay? We did some crazy things to do damage. This just makes me, we did 1-legged pistol squats to do some damage on our quads, but that was not very fun. Anyway, so I'm having flashbacks to bad sorts of things. Okay. Okay. So this is the worst graph in the history of all graphs that have ever been made. But some really cool data. You don't got to work with me on all of this. Okay. This will also be a discourse on how to make and not make figures when you guys go to publish all of your lovely pictures. Okay, so these are people that train either eccentrically only or concentrically only. Okay, we have here and here, you have a measure of their strength, and then here we have the EMG signal in those things. The dark bars are the group that only train doing eccentric movements. Okay, only eccentric movements. So I'm lowering the weight down while I do a curl. The white bars are people that are picking up the weight only. They're curling up. right? What you see here, this is eccentric 1 rep max. This is concentric 1 rep max. This is EMG during eccentric 1 rep max. This is EMG during concentric 1 rep max. Here are the problems. Okay, this is percent change in strength, eccentric, concentric. You guys will note on the y-axis, they're not equal. Okay, this is up to a 60% increase in strength. This is just 40. Okay, so this big bar that you see here is roughly representing the same change as this bar here. They've been made to look visually not that great. Look at this, 460. Okay, it looks like you're getting about 30% there. Look, I'm getting like 225% there. So their axes, there's not fidelity of axis on all of this. Also, all I want you guys to focus on are the last ones, the last in the 3 sets. Okay, you've got pre to mid-training, mid-training to post-training, and then this is the pre to post change that we're going to see here. Okay. So what's the take home of all of this? It's pretty simple. If you train eccentrically, guess what you get better at doing? Eccentric exercise. Guess what happens to your EMG when you do eccentric exercise if you train eccentrically? It goes way up. Okay. So our group, if we test their eccentric maximal strength, the group that trained eccentrically got almost 50% better. Okay. They can lift 100 pounds, now they can lift 150 pounds. The group that trained concentrically, their eccentric 1 rep max went up like 10%. Okay. Only 10%. That was accompanied by a relatively large increase, okay, like a 100% increase in our EMG. When you train concentrically, or when you test people concentrically, my group that trained only eccentric, they got a little bit stronger, but the concentric training group got a greater increase in strength. Similarly, you see the same kind of thing in G7. So these were, again, some of the first data that showed that the nervous system changes and the strength changes are very specific to the type of contraction that you're going to see. Okay? Type of contraction that you're going to see. And I will tell you that this like 45 to 50% increase in strength matched to a almost 100% increase in EMG. These data, although they were not presented in this way in this paper, are likely some of the first that describe why you go do something new and it has an eccentric component and your muscles get damaged and they get sore, and you come back in a couple of weeks and you do the exact same thing and you don't get nearly sore because your strength goes up, but you get that same strength out of a lot more motor unit recruitment when you change these activation patterns. And that is one of the things that goes into all of that. That's partially why eccentric contractions are so good. We'll talk about it later. Eccentric contractions are magic, okay? They're magic. If you had to pick one way to train eccentrically. I mean, you can't ever really train concentric only or eccentric only. You can always get some eccentric in there. But if you had to pick one of the two, do eccentrics. You need the eccentric to get hypertrophy, we think. And when you do eccentric, there's more switch over of the eccentric contractions to concentric than the other direction. Okay, Chris, you had a question.
Yeah, that's going to be another question. So this is all talking about resistance training.
Yep.
Now, if we take into consideration aerobic training, so just increasing your running or actually starting running if you're sedentary,
Yes.
do the same neuromuscular adaptations occur? So does recruitment change when running? Is there a greater recruitment when running change? Or is that just something along the lines of resistance
me make sure that I understand your question.
Yeah.
I don't ever run,
Mhm.
and I start running. What you're asking is, while I am running, am I going to change motor unit recruitment, those kinds of things?
Yeah.
Or are you asking, I start a running program, can we measure during a resistance kind of exercise, during a 1 rep max or during an ABC or something, can I measure changes that might have been the result of air?
No, specifically running. So the first option, does EMG change during running after training? Is there any studies that actually have that? Or is it more of only resistance exercises that are doing EMG testing?
I'm not 100% certain, although I
Okay.
feel like there has to be some data on that. We do know that when you start running, I'm certain you're going to change the neuromuscular pattern that you're using during running. As you become better metabolically able to run faster for longer, you're going to be, those things are going to change. We know the movement economy changes. So the amount of ATP or the energy cost of going at a certain speed changes. That has to be accompanied by a change in the nervous system. Those kinds of things. I'm just not certain off the top of my head what that looks like. We also know that you can do resistance training and it changes your movement economy during aerobic exercise as well. So distance runners need to do weights, which I know everybody hates to hear. Don't worry about that. Okay. Let's do this one and then we'll call it a day. Okay. So the other thing that happens, which you may not think about very much, is also very, very important for athletes, is the rate of force or torque development. Okay. And so more data from Agar. Here were people doing 4 to 5 sets of 3 to 12 reps across 14 weeks. And what they looked at is, this is the rate of force development, okay? And they've broken it down into these millisecond time periods at the onset. So this is the onset of force. I tell Brady, you're going to kick as hard as you can, as fast as you can. And we look at kind of what is the slope of things as we get up to the plateau. Okay. And they also have EMG during those things. So what they did was they looked at sort of peak rate of force development, okay, which turned out to be a little north of 3,000 Newton meters per second, which doesn't really mean a whole lot of anything. And they looked at, okay, well, you're getting this big overall change, but you're faster in the first 30 milliseconds, the first 50, the first 100, the first 200 milliseconds, because it takes about half a second-ish to get up to plateau. Okay, so when you train, the nervous system gets better at activating things faster. Okay, I need this right now. So reaction time gets better. Reaction time gets better. And probably unsurprisingly, if you look at, this is surface EMG from the lateralis, the medialis, and the rectus femoris, you see in those same time epochs, you're going to see sort of greater EMG amplitude, greater sort of rate of change in the EMG amplitude across those things. So the neural signal is bigger and it's getting there faster. Okay? And that corresponds to greater or sort of faster development of force production, which when you get it faster and we can make the peak speed go up, that means we get more power, which means we can run faster, we can jump higher, we can swing a baseball bat or a golf club faster, right? Sarah can spike the volleyball harder into other people's face or something, okay? Kick a soccer ball farther, whatever. What other question? Yeah.
Do you have average time?
Yes, but it's not the way you would think it would go. You do get a fiber type change, but it goes from 2x to 2a. Okay, it goes from 2x to 2a. From 2x to 2a. This fiber type change with resistance training. And you get some, but it's just like aerobic training. It's 2x to 2a. So in theory, it should slow things down ever so slightly. That's not what we see. That's why we think it's all nervous system related. All nervous system. Okay, this is as good a place as any to stop for today. What are we doing on Wednesday? Pardon? We're taking a test, right? Okay. Are you guys